What hope is there for someone who has a drug or alcohol addiction problem? Where can they go for help so they can get their lives back? We spoke to William A. Oswald, the executive director and founder of Summit Malibu, a pioneer in the alcohol and addiction recovery field. We asked him, when did private drug and alcohol treatment centers start up?
Private treatment centers started in the very late 80s, early 90s, and it really happened because of managed care. HMOs, PPOs came in and no longer would pay for a client to be hospitalized, where it normally wasn't covered by insurance. And so slowly but surely private treatment centers started opening. You can find them everywhere. It just depends on the level of treatment, the amenities you're looking for. It's a variety, and it's also a matter of cost.
What kind of team and skills does it take to run a drug and alcohol treatment center like Summit in Malibu?
Well, what we have here at Summit is a medical director, a twice board certified psychiatrist that does an evaluation when they come in. We have a medical doctor that does a history and physical. We do full blood work. We make sure they're healthy, for one, and that they can stay in treatment rather than be hospitalized. Then you have varied types of therapists, everything from PhDs to MFTs that specialize in different categories: trauma, grief, DBT therapy, cognitive behavioral therapy. There's a lot of different components to treatment rather than just this generic program that they run. You have relapse prevention, which is really important for when the client leaves, and that's generally run on a 12-step basis. But while they're here in treatment, they're getting seen by a primary therapist first, and then from there they're in groups with different types of therapy, doing different types of groups. What we really try to reach here in a boutique type treatment center, and especially ours, is to get to the root of the primary reasons why they're being self-destructive. Okay, we all know it's alcohol and drugs of some sort, okay, but what got them there in the first place? So that's their Band-Aid, that's their medication. Why do they need that medication? And there's a lot of work to be done there, a lot of work. And it can be trauma. It could be something that happened when they were 5 years old, they've been carrying for 40 years. It can be grief from losing their parents 10 years ago. The unresolved grief is really important.
How long do clients usually stay for treatment at these centers?
We have them from anywhere from 28 to 90 days. Sometimes I get them for longer. The average length of stay here is about 45 days. Hands down, you're getting about a 35% better chance of recovery if they can stay 90 days or go on to continued care. And the continued care is, I would tell any parent or any spouse that if they can leave here and go on to a sober living, a structured living environment where they're with other recovering people that have some light at the end of the tunnel. They're pretty banged up emotionally and physically when they get here, and we try to support that. And I'd rather they go through it here. I'd rather they go through it when they're in transitional living rather than when they get out on the streets. They're going to go through it again, but at least they have some structure.
How rewarding is it for you to know that you're helping people who have a drug or alcohol problem?
Yes, we're a business, but when I get phone calls from people that have been out there 5 years, 10 years, saying, "Hey, Willie, guess what I got? I got a 10-year chip." It lights me up. Okay, it really does. And but I get to deal with the doom and the gloom on a daily basis. So those phone calls you're talking about, that's the reward. That's the reward. It lights me up.